So if I bring you here, yep.
Physical therapy is a series of treatments designed to decrease pain and improve movement, both quality and quantity, in people who are having pain to make their lives better.
You kind of lean forward like you are now?
The most common reason why people will seek out physical therapy is because they're having pain. We treat everything from low back pain to neck pain to pain after having surgery. One of my favorite sayings is, if you can point to it and it hurts, we pretty much treat it. But we do things like spinal manipulation, joint mobilization, and dry needling. We do instrumented soft tissue mobilization. We do lots of different strengthening and stretching exercises. We also do specific and integrated education on pain and how pain works.
Being cold makes you have more pain. Doesn't really mean that there is injury.
Pain, I like to define as an alarm system within your body. It's designed to tell us when something is potentially wrong.
Well, it doesn't hurt any worse. It does
No change.
a little bit, maybe better.
The problem is that many times pain doesn't necessarily tell us specifically what is wrong with our body. It can only tell us that something may be wrong and that something needs attention. It's more related to how much danger our brain thinks that we're in, as opposed to how much danger we actually are in. The area that is in pain tends to occupy a larger portion of the brain than an area that's not in pain. And that's just due to the fact the brain wants to make it more sensitive to. The way that we do pain education as part of the treatment is first and foremost is establishing a relationship with the patient and helping them understand that everything that they say about their pain experience is real, is valid, and is normalized in the sense that they're not the only ones that are dealing with this problem. This is important, is that ongoing pain that's been going on for months and years at a time, is like a giant African lion. The next thing that we do is I offer to the patient to try and help them answer some of the questions or misconceptions that they may have about their painful condition. If they have a certain belief that is not supported by evidence, sometimes changing their beliefs or changing their idea of what they're dealing with can be profoundly impactful at changing their participation in life and what they're able and choose to do in relation to that condition. You feel just like pressure?
Basically, I had a bulging disc at L3 and L4 and spinal stenosis. Anytime that I travel, I do travel for a living. Sitting on an airplane was excruciating. Going to a theme park, going to the mall, even something as simple as taking a tour of my daughter's school could be difficult, going up multiple levels of stairs. And eventually, you have one of two choices. You can either live with the pain, or you can have optional surgery in my case, and I chose to go with the surgery. Within a week of the surgery, they had me in physical therapy. They wanted me to start learning how to roll over in bed. Something as simple as that is very difficult after a surgery like this. I will be the first person to say that I did not believe in physical therapy. I thought it was a waste of time and didn't really understand what the whole process was. Now, what they've worked with me here is actually pain education, and that's taught me that there is more to point A to point B than I had originally thought. The areas that I've injured, I tend to shield and protect, and especially the right side of my back. I walk differently. I hold my body differently when I'm standing. I tend to stand specific ways that cause the pain, and so he's worked with me to correct my posture, to correct the way I handle and think about pain. If I don't think about it as much, is it really there? In some instances, it might not be.
The simple fact that pain does not equal damage is a huge misconception that is challenging for people to overcome. But once they can change that, it empowers them tremendously, and it makes them realize that just because they're having pain does not mean that they're putting themselves in danger. And when you don't have danger, the alert system, the alarm system, does not go off, or it goes off at a much lower level, and then they can do all the things that are part of the recovery process.
I don't avoid certain activities that I used to. Going to the mall used to be a 45-minute run in, run out. Now I can go 2-3 hours and do things that I once was not able to enjoy. Through learning how to manage the pain and learning where pain starts and stops, I've been able to control it on my own. Whereas before, you know, I might have had to rely on medication for the rest of my life.
Understanding pain within the medical system, truly understanding pain and truly everyone speaking the same language and truly understanding it would have a profound impact on how opioids are utilized within healthcare, as well as how effective our healthcare services could be delivered. Because we all have pain in our lives, we all have challenges where we encounter painful situations, and we know that the more a person understands how pain works, the less pain that they have.